Hello, and welcome to the Dr. Jill Show. I'm your host, Dr. Jill, and today I will be bringing on two special guests to be talking about the widely felt phenomenon, loneliness, and how, amidst the COVID-19 pandemic, it has been made even worse. The COVID-19 pandemic and lockdown has introduced us to a situation that most of us have never even been in before. This public health crisis has brought on several known risk factors for mental health conditions, including things that range from social isolation to unemployment to overall feelings of insecurity and instability. Studies have shown that there's a relationship between COVID-19 and increased symptoms of depression, anxiety, and stress. However, one thing that is often forgotten is the increased sense of loneliness people have gotten. Loneliness is very different from the state of being alone. When someone is lonely, they feel an insufferable distress over their social relationships, while being alone is the physical state of not being with another individual. Being forced to stay at home for months on end without seeing people other than one's family has undoubtedly taken a toll on employment, mental and physical health, and pushed people away from their loved ones, leaving these people very lonely. With all that said, I would like to welcome a very special guest coming all the way from Beaverton, Oregon, who will talk about his own personal experience with loneliness. Let's welcome Dylan Eck. Hello,
Hello,
Dylan. How are you today?
I'm doing pretty good. How about you?
I'm good. Okay, so let's talk about what your school life was like. What school did you go to, and how did you like it?
Um, so for the first 8 years of school, I went to typical public, like fairly big schools, but that changed when I decided to go to a private school called Valley Catholic in Beaverton, Oregon for my high school career. And both the public and private schools had their pros and cons, but overall, in terms of social life and stuff, I like the public schools better.
Okay. And did you ever develop any feelings of loneliness? And did you ever talk to your friends about this?
Um, so when I got to Valley Catholic, it was also like a elementary and middle school. So most of the people who were there already knew each other. And this made it really hard to make friends as cliques and stuff were already developed. And this ended up making me feel fairly isolated and lonely. And I did not really talk to my friends about that very much.
Yeah, I can totally see that happening. Um, how did you feel like seeing these people around you connecting in groups? Was it easy for you to make friends with these people?
Um, it was hard partially because I don't think I could relate to them very well due to me having a very different experience growing up than most of them did. Like most of them grew up at that same school, hadn't had very much change, at least in that aspect, versus I had been moving around schools and stuff. And it was also just hard to be friends with them because they never, or a lot of the times they didn't really put a whole lot of effort into like making other friends since they already had their established groups.
Mhm. Effort is definitely crucial in maintaining and creating relationships with other people.
For sure.
Um, how did you handle your loneliness when you were in school? Did you have any methods you used, and how has this changed while being a student at Gonzaga, if it has at all?
So the biggest method I would use is I'd try to take up all my time, and I'd typically do that by playing sports. So 10 out of the 12 possible seasons I could have played, I was playing a sport. And I mean, one of them was during the COVID stuff. So I didn't have a choice. I couldn't play. Um, and at Gonzaga, I've not noticed the same thing. I think a big part of it is the nobody really knew each other going into it. So everyone was trying to get to know everyone else. And that made it easier to talk to people. And so I haven't really had to use any sort of coping mechanism like that since I got here.
That's great to hear. And lastly, do you have any advice for people feeling lonely?
Um, I'd say just do your best to put yourself out there and reach out to other people. Like, I mean, it won't always work out. They won't always like respond the way you want them to respond, but that's more
Mhm.
on them than it is on you. And I mean, like, it's if you do something, you give yourself a shot at like forming relationships and therefore feeling more fulfilled with it.
Okay, thank you so much for coming on today, Dylan. Your
Thank you for
stories have
having me.
been your stories have been incredibly insightful. Our next guest comes from the small town of Prescott, Arizona. Let's welcome Dr. Blair Carrot. Hi, Dr. Carrot. It's a pleasure to have you on this show.
Hello, it's a pleasure to be here.
So, Dylan and I have been talking about how the COVID-19 pandemic and lockdown has been affecting people's mental health. Can you talk more about the consequences of COVID-19 on mental health, as well as how it affects people with pre-existing mental health conditions?
Absolutely. A couple of situations that have been caused by the COVID-19 pandemic, such as lockdown, social distancing orders, and then stay-at-home orders, they've had a very large impact on the mental health of college-age students and the entire population. What some of those are is we've seen an increase in feelings of anxiety, feelings of depression, suicidal ideations. People have been having trouble with leaving their house, a lowered amount of physical activity, increasing amounts of time spent on their phone, which can all lead to making the symptoms of mental disorders much worse. We've also seen that people who had previously diagnosed mental disorders, their symptoms have increased with COVID-19, with the COVID-19 pandemic.
Okay, yeah. Thank you for sharing that. So, there seems to be a correlation between COVID-19 and the development of loneliness. In your research, how is this statement supported?
Well, we have done a couple different forms of research. We've done surveys and then a couple of different research methods where we look at the usage of phones and like location of where people have gone. And we've seen that social isolation and loneliness, they're together and they have drastically increased the risk of depression and possibly anxiety, but it is more correlated with depression. What's happening is the duration of loneliness and the level of loneliness that people are feeling, it is definitely increasing the symptoms of these mental health disorders. Now, children and adolescents, they are most likely, more likely to experience higher rates of depression and anxiety caused by their feelings of loneliness because they are more likely to be feeling lonely during this time because they're not attending school, they're not being able to see their friends, which were all routines that they had previously experienced before. So that change is going to have a large impact. Furthermore, we've also seen that the mental health problems that they had before, after isolation and quarantine, the children who had that, they've experienced higher rates of having post-traumatic stress disorder. We've seen an increase about the children that were tested, about 30% of them tested positive for having high rates of PTSD afterwards. So it's something that we need to be very cautious of. We need to definitely pay attention and we need to focus on ways to support these kids and everybody else afterwards and during the continued pandemic.
Yeah, thank you for answering all of my questions, Dr. Kara. You did them very well. And before we leave, can I ask you one more important question?
Absolutely.
So, what exactly can be done to combat all of this loneliness and deterioration of mental health we may be experiencing? Is there anything we can do while at home to cope?
Absolutely. There are a couple of things that we can do. First of all, one of the main things that people can do is maintaining structure and a routine during your day. maintaining a specific time that you're going to try to get up in the morning, when you're going to eat your meals, and just kind of trying to continue to live life as you would while still remaining safe. Also trying to stay connected with people, having those calls that you would have, having interactions with people, maybe family game nights, while still trying to stay safe. And then another thing that needs to be done is we need to have, schools and the clinical services, we need to have them provide lots and lots of support, such as the suicide hotline, also having support with like therapy and other things like that, just where people can go in and get help when they need it.
All right, thank you, Dr. Carrot. To wrap up, I would like to thank both Dylan Eck and Dr. Blair Carrot for showing great courage with providing us with stories and helpful information that we all need in these dark times. For more about COVID-19 and information about mental health resources, please check out our website. Thank you for joining us today.